Hi guys, my name is Dr. Insiya. This is Pimpu, and welcome to the first episode of I'm a physio, but I don't know how to.
I am a physio, but I don't know how to move like a pro. Yeah, tell me what to do.
And today we are going to talk about all about lumbar traction and how do you give it to patients. First one being supine, which is the most commonly used position, where there's a stool placed under the knee and the hip knee is bent at 90-90 each. It is good because it reduces lumbar lordosis and increases the traction force on the intervertebral disc. The second position being prone position, that is facing down, ulta. There's a pillow has to be placed under the abdomen so that it reduces the pressure on the abdomen and the spine. Now comes the third one, that is sitting or semi-Fowler's position. This may the patient has to be reclined at 30 to 45 degrees and the knee is supposed to be bent. ठीक है, and this is yes less frequently used because थोड़ा inconvenient होता है and it gets a little difficult to manage patients in this, and plus वो traction force इतना नहीं आता है. But it can be given to patients who cannot tolerate supine and prone. I mean option नहीं है तो फिर ये कर सकते हैं. Let's talk about how much traction force should be given. Up from 25% to 50% of the patient's body weight. Well, if the patient's weight is 70 kg, तो उसका 25% होगा 17.5 kgs and 50% होगा 35 kgs. The amount of traction that you can give minimum is 17.5 kgs and maximum will be 35 kgs. So उसके बीच में how much ever the patient can tolerate can be given. So now the time for giving the traction could be from 10 minutes to 20 minutes. Lastly, let's talk about mode. So there's intermittent and continuous. Usually patients prefer intermittent because it helps in resting. I mean, there's a rest period, there's a hold period. So even the patient gets a little bit to relax and वो continuously खींच नहीं रहा है, so it's a little less irritating and it's a little comfortable for the patients as well. Thank you guys for watching. I hope you all learned something and enjoyed. Bye.